This is an equipment video on how to use the Phillips monitor. First, to turn it on, you'll press the power button, and then you'll wait for it to come on. You will hook your patient up to the monitor, and then you should start to see their vitals come across the screen. Instead of turning the monitor off, you can also put the monitor in standby, which is this button. And then to get it out of standby, you just click the screen. So when you first have your patient come up, you want to go ahead and make sure you put them in the correct profile for what age they are. So I'm going to switch to an adult profile and confirm. And it will switch into that mode and it will change your high and low limits. If you still need to manipulate your high and low limits, you can click and change your high limit for your heart rate or your low limit. You can also change for your O2, high and low limits. Then you can also change your DSAT limit. Do these based on the doctor's orders, and then you have the same for the respiratory high and low limits. And then if you need to add more wave trends than just these four, like if you have an art line or an ICP, you would click your wave trends and you could go to 6 or 8. When you switch to 6, you will also need to input a new pressure cable. So once you put the pressure cable in, you can click this button here, your measurement selection, and then whatever is grayed out is not activated. So you would need to activate an arterial blood pressure, and then you can activate. Because I don't have a pressure cable in, it's not going to come across the screen, but then you would have a 5 waveform. To deactivate something, you would click on it and then click deactivate. I'm going to reactivate this. So just some tips on the EKG. If you're not getting a good reading on your EKG, if it's double counting or if it's fuzzy, you can click on it and you can auto size it. If that doesn't help, you can also switch from monitor to filter. And then if that doesn't help, you can switch between leads. So right now we are in the second as primary lead. You can also switch to first. And to third. I'm going to switch back to second. Usually we're in the second primary lead. Some tips on your non-invasive blood pressure. You can set your high and lows again for your maps, and then also you can switch it to, if they want to monitor based on a systolic or diastolic, you can do these, or you can do both. If you do systolic, then you're going to have a systolic high and a systolic low that you can change. Also, if you have a little patient that you're not getting a good blood pressure read on and you're using the neonatal pressure cable, you can switch and use the adult pressure cable with the orange blood pressure cuff, and that will help you get a better read on those patients. And then for all of your vital signs, you can set or for your blood pressure, you can set how often you want it to cycle as well. And you can do your repeat time every hour, or if you're in a emergency or procedure, you can switch it to a lower amount, like 2 minutes. So other tips and other things you can do with the monitor is you can do a QRS volume. So when there's a procedure going on, the doctors like for a QRS to be set. So you click this QRS volume and you would raise it up to 7 and you will hear that QRS noise. When you want to turn it off, you just change the volume back down to 0. If the alarms are not dinging outside of the room, to troubleshoot that, you need to check the boom, the monitor all the way to the boom. It's usually this cable has come undone. So if you are alarming inside of the room and there is not a light going on outside of the room, then this cable is most likely disconnected at some place. But if you cannot troubleshoot it and fix it this way, then you need to have engineering come and check it. Also on the monitor you have a calculator, which is down in this part here that you can use. You can also add other patients that you want to watch. In order to do that, you go up here and you click one other patient, so you can watch your vital signs on your other patient as well. In order to go back, you just go back to your 4-wave screen. Another mode that the doctors might want you to put the monitor in is called angel mode. If your patient is withdrawing or passing away and they want the monitor to not alarm, you would set the monitor in what we call angel mode. In order to do that, you go to profiles and you would click profile details, measurement settings, and then angel watch. And then you have to confirm that. This will change all of your vital signs to a purple. And this lets you know that there will be no alarms, but the vital signs will still be on the screen. Also, the doctors might not want the vitals to be on the screen in the room and only to be on the screen by the nurse's station. In order to do that, you would exit out of this and you would go here, go down to the bottom, and then there will be 4 stars. When you do that, it either comes up with a clock or just a blank screen. And so there will be no vitals on this screen, but they are still being monitored and they will show up on the screen outside at the nurse's station. And to go back, you'll just click your profile again. And then lastly, the only thing of advice is these monitors, when you disconnect them and you take a patient either to the floor or to OR, you click this button and then you slide it off. And then this monitor goes with you. There's a silence button on here. You can see everything too. And then you also have that QRS volume. But do not leave this monitor with OR and do not leave it on the floor. It has to come back to the PICU and back to the room. And then to put it back on, you just put it up and then slide it back. Okay, that completes the video on equipment video for the monitor.